Temkin Beck, 1921 to 2021, was an American psychiatrist who is widely recognized as the father of cognitive therapy, later expanded and formalized as Cognitive Behavioural Therapy, CBT. His work fundamentally transformed modern psychotherapy and had a profound influence on the treatment of depression, anxiety, personality disorders, and numerous other psychological conditions. Early life and education. Aaron Temkin Beck was born on July 18, 1921, in Providence, Rhode Island. He completed his undergraduate studies at Brown University in 1942 and received his MD from Yale Medical School in 1946. Initially trained in psychoanalysis, Beck became disillusioned with its theoretical limitations, especially when addressing depression. Development of cognitive therapy. While working at the University of Pennsylvania, Beck conducted research into depression and noticed that many of his patients experienced automatic negative thoughts about themselves, the world, and the future. These observations led him to propose the cognitive triad, a core feature of depression, comprising negative views of the self, the world, and the future. He posited that maladaptive thoughts and cognitive distortions, such as overgeneralization, catastrophizing, and dichotomous thinking, played a key role in the development and persistence of mental disorders. This insight laid the groundwork for cognitive therapy, a structured, time-limited, and goal-oriented form of psychotherapy that focuses on identifying, challenging, and replacing distorted thoughts with more realistic and adaptive ones. Cognitive Behavioral Therapy, CBT. Beck's model was later integrated with behavioral techniques to form cognitive behavioral therapy, which has since become one of the most widely researched and empirically supported forms of psychotherapy worldwide. CBT is now used to treat a wide range of conditions, including depression, anxiety disorders, PTSD, OCD, and eating disorders. Key publications: Cognitive Therapy and the Emotional Disorders, 1976. Depression, Causes and Treatment, 1967. Cognitive Therapy of Depression, 1979 with Rush, Shaw, and Emery. Prisoners of Hate, 1999. Numerous academic articles and therapy manuals. Contributions and legacy. Aaron Beck also developed tools for psychological assessment, such as the Beck Depression Inventory, BDI, and Beck Anxiety Inventory, BAI, which remain standard in clinical practice and research. In 1994, he co-founded the Beck Institute for Cognitive Behavior Therapy with his daughter, Dr. Judith Beck, to advance training and research in CBT globally. His legacy includes not only the widespread clinical adoption of CBT, but also the reshaping of how clinicians understand and treat mental illness, placing emphasis on cognition and learning rather than unconscious processes. Aaron Beck passed away on November 1, 2021, at the age of 100, leaving behind a monumental legacy in psychology and psychiatry. Cognitive Therapy of Depression, Introduction and Overview. This foundational text outlines the theoretical underpinnings, clinical methods, and therapeutic strategies of cognitive therapy, CT, for depression. The authors argue that depression is primarily maintained by distorted cognitive processes, rather than unconscious conflicts or biochemical imbalances alone. The book marks a deliberate departure from traditional psychoanalytic and biomedical models, asserting that depression can be effectively treated by helping patients recognize and correct maladaptive thoughts. Part 1. Theoretical Foundations. Chapter 1. Historical and Theoretical Context. The opening chapter critiques the prevailing models of depression in psychiatry at the time, chiefly psychoanalytic theories and biological psychiatry, arguing that these models offer insufficiently effective treatments. Beck and colleagues introduced their alternative, that depression arises from systematic negative thinking patterns, especially those concerning the self, the world, and the future, known as the cognitive triad. Chapter 2. Cognitive Model of Depression. Here, the authors lay out the cornerstone of cognitive theory. Individuals interpret events through internalized belief systems. In depressed individuals, these belief systems are often dysfunctional, leading to negative automatic thoughts and cognitive distortions such as overgeneralization, magnification of negatives, and selective abstraction. The model is not merely descriptive, but offers a roadmap for intervention. Chapter 3. Schema Theory. This chapter introduces schemas, deeply ingrained belief systems or cognitive structures that shape how individuals perceive and interpret their experiences. Depressed individuals are thought to hold rigid, negative schemas that predispose them to interpret neutral or positive events in a negative light. These schemas are often latent and activated by stress or loss. Part 2. Clinical Applications. Chapter 4. The Therapeutic Relationship. Beck et al. Stress the importance of a collaborative, problem-solving relationship between therapist and patient. The therapist is not a distant analyst, but a guide and coach, helping the patient test beliefs and restructure thinking through collaborative empiricism. Chapter 5. Cognitive Techniques. A core set of techniques is described, including identifying and recording automatic thoughts, challenging distortions with evidence, replacing maladaptive thoughts with more balanced alternatives, conducting behavioral experiments to test beliefs in real-world contexts. These techniques aim to disrupt the reinforcing loop between negative thoughts, emotions, and behaviors. Chapter 6. Behavioral Interventions. Though primarily cognitive in focus, the therapy integrates behavioral strategies such as activity scheduling, graded task assignments, and behavioral activation to help patients break cycles of avoidance and inertia. Chapter 7. Modifying core beliefs. Once patients gain mastery over automatic thoughts, therapy shifts focus to deeper core beliefs or schemas. These are addressed through Socratic questioning, guided discovery, and systematic testing over time, leading to more enduring change. Part 3. Clinical Considerations and Case Examples. Chapter 8. Diagnosing Depression Cognitively. The authors distinguish between endogenous, biologically driven, and reactive, situational depression, though they ultimately argue that the cognitive model applies across subtypes. They introduce structured assessment tools such as the Beck Depression Inventory, BDI, and emphasize the importance of identifying depressive thinking patterns during evaluation. Chapter 9. Suicide Risk and Severe Depression. Special attention is given to suicidal patients. The authors recommend focusing on short-term problem solving, increasing activity levels, and helping patients reconnect with hope. Cognitive therapy is adapted to address hopelessness, a key driver of suicidal ideation. Chapter 10. Termination and Relapse Prevention. The final phase of therapy involves consolidating gains and equipping patients with relapse prevention strategies. Patients learn to monitor their thinking, self-correct distortions, and develop realistic expectations about life challenges. Booster sessions may be scheduled to reinforce skills. Conclusion. A new paradigm in psychotherapy. The book concludes by asserting that cognitive therapy offers a scientifically grounded, structured, and time-limited alternative to psychoanalytic and purely pharmacological approaches. Its focus on present-moment thinking patterns makes it accessible and empowering to patients. The authors argue that with proper training, therapists can achieve strong clinical outcomes and help patients reclaim agency over their moods and lives. Legacy and influence. Since its publication, cognitive therapy of depression has become a cornerstone of modern psychological practice. It laid the groundwork for the broader field of cognitive behavioral therapy, CBT, and has influenced countless adaptations across disorders, from anxiety and OCD to PTSD and personality disorders. The work also catalyzed decades of empirical research, affirming CBT's efficacy in randomized controlled trials and health systems worldwide.